My name is Dr. Collin Ottey. I'm an internal medicine physician. I work for Advanced Community Health Center here in Raleigh. Advanced has been around for over 50 years. I'm the executive medical director. We provide primary care services to individuals in Wake County and also in Franklin County. Yeah, I originally grew up in Jamaica. I attended college in Brooklyn College, and medical school at University of Illinois at Chicago. I have a special interest in primary care and providing care to the underserved. What drew me to medicine was the desire to care for people, and also as a child growing up, I always liked that doctors were able to prescribe medications for me and I felt better afterwards. So felt like I'd be like some of those people that were caring for me as a young child. Yeah. My interest now in terms of medicine, it's to continue the work. My interest in terms of serving people, the underserved, or people who are dealing with some of the health disparities. Yes, as a physician at Advanced, I have a great opportunity to do that and also to influence the care that we can provide as an organization. One of the biggest reasons, I think, is fear. People sometimes don't want to know that they have a medical condition because of lack of knowledge and because of what they may assume the condition may be or the outcomes. That creates a level of fear. So sometimes they feel like they're better off not knowing certain if something is wrong with them. But also we have to deal with some social determinants of health issues as well, such as transportation, work issues. People may not be able to get time off from work to go to the doctor. That's why we have to make healthcare more flexible for people to access services. We have to deal with issues of daycare. If you have children that you have to take care of, that could be an hindrance towards getting health as well. Lack of insurance as well, financial resources to receive health care could be a barrier as well. In addition to access to services, if you live in a rural community, again, if you don't have transportation, you might not be able to access health care in a center like Raleigh if you're living in somewhere like Franklin County, because they may have limited number of specialty services in those communities. Also limited number of primary care services in those communities as well. It's important for African Americans or people of color to get screening is because it can, number one, help to reduce health disparities. Early detection and screening can help people to get care much earlier during a disease process than waiting until when they start experiencing some symptoms, at which time sometimes these conditions are in terminal stages where very little can be done to treat their conditions. So it's important to get screening so that we can reduce morbidity and mortality as it relates to those specific conditions. And with numerous screening tools that are available to us now, individuals can access these screening tools through their primary care physicians or providers. I have one story of a patient. At the time he was in his 40s, he had a history of family history of prostate cancer. So we always talked about that. And it so happened that we had referred him to a urologist for something unrelated to prostate cancer per se. And it turned out that he had a normal PSA because we were monitoring that. And it turned out that he had prostate cancer. And he, even though he had a normal PSA, but based upon one of the exams that we did, it was concerning to me, and I referred him to a urologist. So had he not done that digital rectal exam, which a lot of men are afraid to have, we would not have discovered his cancer at that time. So that's why it's important for men to not be afraid of the rectal exam, to get screened for prostate cancer. although we know the PSA, they can always do a PSA test as well, but the combination is very helpful in terms of screening for prostate cancer. But we know there are a lot of treatments out there for prostate cancer in terms of African American men that could also help reduce morbidity in African American men if they get screened for prostate cancer. I think one of the things that can be done, we need more healthcare providers of color. I think that in itself can develop, people can relate to each other, and that will help to build trust. Yeah. In addition to that, insurance issues can also help as well, because sometimes patients feel as if providers are delaying care or preventing them from getting certain types of care that they need, but they don't understand that we have barriers that we're dealing with, such as issues with insurance companies that can approve or deny services. So those type of things. But relationship and providers also need to be able to develop relationships with their patients as well. So that's where things like cultural competency comes into play as well, because it sometimes, even though you might identify with the person's ethnicity as well, but sometimes if you're able to develop a understanding of their culture and who they are as a person, you can develop trust with that patient. So that's important as well. First things we have to do is to start treat patients as how we would like to be treated if we are a patient, if the roles were reversed. And we have to treat every patient with respect. We have to give patient that level of, the level of respect that they need, regardless of how young or how old they are. Yeah, I think we should definitely, that should be something that we all do, because we have to see that person as a human being and not as a disease process. So Ms. Brown doesn't just have diabetes, or she's diagnosed with diabetes, or as we refer to them, patient sometimes, patient is a diabetic. But she's a person, she's a mother, she's probably a grandmother, she's probably someone who has been working for X number of years she could be a person who's in charge of a department at her job. So she's just as important as we are as, say, physicians. So we should try to give them that level of respect and allow the patients to share with them what their concerns. We should always have room for that in our visits when we're dealing with patients. First, they should not be afraid to communicate with their providers, to ask questions. They should want to know, like, what is their main condition, what's the main problem that they're having, in terms of speaking with their providers. And they should be able to know if there's something that can be done to treat their medical conditions. Yeah. And as far as the screening, they should be open to speaking to their providers to say, I'm 50 years old now. What things do you think I need as far as my health screening? Sometimes they should open those dialogues with their providers and not be afraid to talk to their providers. There are some things, with technology now, we can do telehealth visit. If they're uncomfortable with the direct face-to-face visit with their provider, they can do that through telemedicine, which can help to break down some of those barriers. And I think that could be a gateway to get some of those people into the office with a provider directly.